understanding dyslexia, dyscalculia, dysgraphia, and other co-occurring conditions. In this video, we're going to outline the main features of dyslexia, dyscalculia, dysgraphia, and other co-occurring conditions. Firstly, dyslexia. Dyslexia is a learning difference that can cause difficulties with learning and work. However, with the right understanding, accommodations and support, people with dyslexia can achieve great success in education, the workplace, and in wider society. Everyone with dyslexia is different, but there is a commonality of difficulties with reading, spelling, and writing, and also some related cognitive or processing difficulties. Dyslexia is not a general difficulty with learning. It impacts specific skill areas. The impact of dyslexia can change according to the environment. That is what a dyslexic person is being asked to do and under what circumstances. Some people with dyslexia can also experience difficulties with sequencing information and also difficulties with orientation or direction. Short-term memory can also be an issue. Many dyslexics lack confidence in their abilities, and this can worsen their difficulties or lead to stress or anxiety. Also, dyslexics can often find it takes them much longer to undertake certain tasks when compared to their non-dyslexic peers. Dyslexia affects approximately 1 in 10 people. It occurs on a spectrum, with some people mildly affected and others more severely. Estimates of prevalence vary significantly and depend on the particular definition of dyslexia used in each research study, as well as other factors, including language complexity. Depending on the definition used, between 4% to 17% of the population may be considered to have dyslexia. The international consensus, though, is 10%. While people with dyslexia may develop strengths due to their dyslexia, such as determination, problem solving, and resilience, dyslexia does not automatically bring specific gifts or talents. Some people prefer the wording "a person with dyslexia," while others prefer the term "a dyslexic person." When working with individuals, it's important to use the terminology that this person is most comfortable with. Dyslexia is a recognised disability under EU law. That's Equalities or Accessibility and Disability legislation. However, many dyslexic people do not consider themselves disabled, and the individual's views should be respected. In different jurisdictions and at different points in recent history, other terms have been used for dyslexia, including specific learning disabilities. Okay, so what about dyscalculia? Dyscalculia is a learning difficulty that can cause difficulties with core mathematics. It affects approximately 6 to 8% of the population. It occurs on a spectrum, with some people mildly affected and others more severely. And with the right understanding, accommodations and support, people with dyscalculia can achieve great success in education, the workplace, and in wider society. People with dyscalculia lack an intuitive grasp of simple number concepts, or what we sometimes call number sense. They can have difficulties estimating the magnitude or size of numbers, and they sometimes have poor understanding of number relationships and lack fluency with simple numerical operations. Often, if the right answer is achieved or the correct procedure followed, it's done so quite mechanically, with great effort and without confidence. Students or adults with dyscalculia will often experience a lack of confidence or low self-esteem as a result of previous experiences with trying to study maths. These students often experience difficulties with basic mathematical or numerical tasks or processes such as adding, subtracting, multiplying, or dividing. Students can also experience difficulty knowing which mathematical process should be used based on the context. Other challenges can include telling the time, especially using an analog watch or clock, and sometimes handling money or calculating change can be challenging too. Some students struggle to read and understand the vocabulary in math questions, and therefore don't know what task they're being asked to do. Many different words can be used to describe the same action, of course, like add, increase, plus, total. Difficulties with orientation and direction can lead to confusion of math symbols. Some people with dyslexia struggle to decode symbols accurately or quickly. Memory can also be an issue. Confidence and anxiety can be an issue, and many dyscalculics lack confidence in their own maths ability, and this can worsen their difficulties. It's important to remember that dyscalculia is not a general difficulty with learning. It impacts specific skill areas. And the impact of dyscalculia can change according to the environment, what the dyscalculic person is being asked to do, and under what circumstances. Some people prefer the wording "a person with dyscalculia," while others prefer the term "a dyscalculic person." And when working with individuals, it's important to use the terminology that they are most comfortable with. And when communicating with a wider audience, say a website, the terms may be used interchangeably to reflect that variation of preferences that exists. Dyscalculia is a recognised disability under EU law. And there's a high incidence of co-diagnosis of dyslexia with dyscalculia. And this obviously leads to greater challenges for these students. Okay, on to dysgraphia. Dysgraphia serves as an umbrella term to describe difficulties with writing that significantly impact on academic or daily life. Writing can require additional amounts of concentration and effort, and these difficulties persist despite the provision of extra support and intervention. For example, there may have been additional support when at school. The difficulties with dysgraphia could be physical difficulties, leading to illegible or very slow writing, difficulties with applying the rules of spelling or grammar or punctuation. The difficulties could be organisation of ideas in writing that maybe sometimes doesn't always follow a clear logical sequence. Or the difficulties could be a combination of any of the above. If a writing difficulty originates primarily from number one, a physical or a fine motor difficulty, then it would be most appropriately assessed by an occupational therapist. Related accommodations might then be focused on physical or manual interventions. And for many individuals with a diagnosis of dyspraxia or developmental coordination disorder, physical writing difficulties are very much part of their dyspraxia presentation. If dysgraphia is more a difficulty with the rules and conventions of written language, or the ability to express ideas in a way in line with their oral ability, then it's usually assessed by an educational psychologist. For many dyslexic individuals, difficulties with writing are very much part of their dyslexic profile, and these writing difficulties would be commonly identified as part of an educational psychology assessment. It is possible that someone could be assessed as having dysgraphia without being either dyslexic or dyspraxic. And many learning differences can co-occur, so there may be more than one reason for the challenges that an individual may experience with writing, irrespective of or in addition to a diagnosis of dysgraphia. And we're going to cover that in the next section. This last section is to do with other co-occurring conditions. Dyslexia, dyscalculia and dysgraphia don't always occur in isolation, and they often co-occur with each other, and also with other learning difficulties or neurodivergent profiles. These can include ADD or ADHD, autism, DCD or developmental coordination disorder, commonly known as dyspraxia, or DLD, developmental language disorder. Appropriate identification of all the educational needs of an individual is really important, as this enables the implementation of a range of suitable interventions. So, what are these other co-occurring conditions? Well, ADD or ADHD, that stands for Attention Deficit Disorder, or sometimes Attention Deficit and Hyperactivity Disorder. This is a condition causing persistent difficulties with things like attention, hyperactivity, and sometimes impulsivity. Autism is a lifelong developmental disability or difference which relates to how a person communicates and interacts with others and how they experience the world around them. Next, we have dyspraxia, or again, developmental coordination disorder, DCD. This is a specific difficulty with movement and aspects of learning such as thinking out, planning, and carrying out some sensory or motor tasks. And then we have developmental language disorder. This primarily affects communication, and there are often difficulties in language understanding, expressive language skills, and using language in everyday situations, including some speech sound difficulties. So, in this chapter, we've outlined the main features of dyslexia, dyscalculia, dysgraphia, and also talked about how these things can co-occur with other conditions.